All right, here we go. Hello, everyone. My name is Dr. Marty Kotler. Thank you for attending this presentation. Today's topic is Medicare participating versus non-participating. Here's our legal notice. And before we get started, let me tell you a little bit about myself. Again, my name is Dr. Marty Kotler. I'm a chiropractor. I am certified in CPT coding and a certified professional compliance officer. I've written many books on billing and coding for chiropractors. I write articles for chiropractic economics and dynamic chiropractic. I'm also a guest speaker at many chiropractic conventions nationwide like Parker Seminars, Foot Levelers, and I also speak at many chiropractic state association conventions nationwide. So the decision to become a participating provider with Medicare versus non-participating provider is a decision that can be changed every year. Typically the last 6 weeks of the year, up until December 31st, you have the opportunity to switch your status. Now, before we get into, in my opinion, the main difference between par versus non-par, I need to emphasize that whether you're par or non-par, you have to make a decision first. Do you want to see Medicare patients? If you want to see Medicare patients, then you need to get a Medicare PTAN number, Provider Transaction Access Number. Let me take a step back. You first need to get an NPI number, fill out the CMS 855 form, then you'll get your PTAN number. Once you get a PTAN number, then you get an opportunity to become par or non-par. Most chiropractors that I work with become participating. But again, before we get into that, if you do not have a PTAN number, then you should not be seeing Medicare patients. Just let me repeat that. If you don't have a active Medicare provider number, you should not see Medicare patients. So assuming you have a number, now you are par or non-par. Now, whether you're par or non-par, you still need to take a history on a patient. You need to follow the Medicare documentation guidelines. For example, on the initial visit, a history to include the mechanism of injury, description of the illness, little past history, family history. You need to do the part exam, the Medicare part exam. You should also discuss the contraindications to chiropractic and then come up with the subluxation diagnoses and the secondary diagnosis codes. Come up with a treatment plan and include your schedule of care, the goals that are going to be demonstrated, and how you're going to measure functional improvement. You want to take good SOAP notes and do re-exams, and if you're going to be billing Medicare for those services, again, if you're par or non-par, you need to follow all the Medicare guidelines and understand the difference between CPT codes 989404142 and the main Medicare modifiers as it relates to chiropractic, like the ATGA, GY, GZ. So once you get past all of that, remember, those are the things, all of those things are required whether you're par or non-par. Now, main difference, in my opinion, is the way in which the financial arrangement is made. So on your screen, you'll see if you're a participating provider, and let's say your regular fee for a chiropractic adjustment is $35 for a 98940, 1 to 2 reaching chiropractic adjustment or manipulation. Your regular fee is $35. Now, because you're a par provider, you have to accept 32, as you see on the screen. In this example, that would be the allowed amount. So assuming the deductible has been met, the patient pays you 20% of the par fee, which in this case would be $6.40. You bill Medicare your regular fee. Medicare is going to pay you $25.60, which is 80% of the 32. So $25.60 plus $6.40 gives you the 32. And the difference between your regular fee and the par fee, in this case $3, that needs to be written off. Can't collect it from the patient. Medicare is not going to pay you. So there's 2 more situations, and so you have a total of 3 choices. As a par provider, this is your only choice. Now, as a non-par provider, there are 2 choices. Let's say you want to see Medicare patients, follow all the Medicare medical necessity rules versus maintenance care. All the ABN situations also are required to be followed, whether you're par or non-par. But you say, you know what, I want to be non-par. I'll see Medicare patients, but I want to collect my normal fee. So if my normal fee is $35 for 98940, and I don't want to accept assignment, I want the patient to pay me on the day of service. So I want to charge $35. Well, Unfortunately, in this example, you'll see that the limiting charge is $34, so it's only $1 off. So as a non-participating provider and you're not going to accept assignment, that means the patient is going to pay you the limiting charge. In this case or example, it's $34. You cannot accept your regular fee of $35 even if you're non-participating. So you're going to bill Medicare the limiting charge of $34, and then Medicare is going to pay the patient, which is what you want to do in this situation. You don't want the payment coming to you because you're going to have the patient pay you. So the check you want to go to the patient. So Medicare will reimburse the patient $24, which is 80% of the non-par fee. It's 80% of the non-par fee, not of the limiting charge. And this is the last choice right here. You're non-par and you want to accept assignment. So as a non-par provider and accepting assignment, the patient will pay you 20% of the non-par fee, which in this case would be $6. That's 20% of 30, and you're going to bill Medicare 30. Medicare will reimburse you, the provider, 24, which is 80% of the non-par fee, again, assuming the deductible's been met. So that's the main difference between par and non-par. So please check with all the carriers. Don't use the fees that I gave you. Check with all the carriers you bill prior to submitting claims based on this information. Target coding does not guarantee that this information will guarantee payment from any insurance carrier or patient. Please stay on top of the rules. Attend seminars, webinars, join your national and state professional associations. Here's something that we're offering. We call it 15 minutes. Could help you collect an extra 15% or more. We have a coding evaluation form, which you can get at the end of this video. Fill it out, send it in, and we'll schedule a 15-minute chat to see how we can help your practice. We also offer something called our Smart Choice program, and as you can see on the screen, it'll help you sleep. It'll help you sleep well at night because this is a friendly evaluation of your practice. It takes about 3 to 4 weeks to get through, and then you're on your own. It's an evaluation, a recommendation, a treatment plan. It's a one-time fee, and sometimes it takes 3 weeks, sometimes it takes 4 weeks. We don't have a clock on it, but that's the average, about 3 to 4 weeks, and then you're on your own. Let us know if you're interested in that. We also have a whole bunch of upcoming webinars on compliant cash plans, insurance verification, the 1500 form modifiers. Let us know if you're interested in attending these. Go to targetcoding.com for more information. We also offer memberships which include unlimited access to all of our live webinars and our recorded webinars, the member-only section of the website where we have our newsletters and a whole bunch of videos. So membership, we do offer those. Just go to targetcoding.com and click on the services page. You'll see the information about the Smart Choice programs and the seminars and the memberships. We also have seminars. There we go. We have seminars coming up on advanced chiropractic record keeping, ICD-10, compliance, documentation, 6 CE credits approved in many states. So let us know if you're interested in that. Just go to the seminars page at targetcoding.com. We also offer a nice array of products and DVDs and guidebooks and forms, and many of these things are included. So we recommend you don't buy them, just become a member, and many of these things are included in the program. So, but you can buy them a la carte. That's fine. Again, fill out the form. Let us know. Thank you for attending. There's our contact information. Take care, everyone. Bye-bye.